and find out questions, get answers to your questions about what drug should I be on, why am I having these problems, what should I do differently. These are social network sites that our patients are going to. So social networks growing 3 times faster than online growth, and most of the audience, interestingly enough, is 35 to 49 years old, which is kind of the sweet spot for a lot of decision makers in healthcare. So what are the pros and cons of social marketing? The pros are it starts to engage customers in their own healthcare, which we know customers want to be engaged in their own healthcare. And it allows for that grassroots activation. If you can get a customer to understand your product and the benefits of your product that early in their diagnosis and their understanding of their disease, you're going to have strong influence on them. The cons are, this is really completely outside of regulations. We can't go into chat rooms and advertise. We can't go to any of these places. But you saw my earlier diagram about the water. This is the ocean. You know, we're playing in a tiny drop of it. This is where a lot of things are happening. In the U.S., the last 2 points, in the U.S. in particular, pharma is very nervous about it, and they've probably got 3 lawyers sitting beside them when they talk about these things because they're worried about that they cannot, in a social network, provide fair balance, which is a big thing for them. And they're also worried that there's going to be an over-reporting of adverse events. So some real concerns about social marketing and how pharma can play in it. So what is pharma doing? Because they're not actually sitting on the sidelines doing nothing. On February 11th this year, AstraZeneca launched a YouTube channel for Symbicort. Go home, click AstraZeneca Symbicort, and you'll see a little YouTube video on Symbicort. Still one way, but they're starting to dip their toe into the water. They're not the only ones, so GSK, J&J, Sanofi, and others are involved in this as well. Pfizer in Europe launched a pan-European stop smoking campaign. It's not about a drug, so it's a little outside of this, but they're using Facebook and Twitter to engage patients in, should I stop smoking? How do I do it? I'm stopping smoking. Why don't you stop smoking too? That's the grassroots that Pfizer's trying to get into. J&J's LifeScan division has a section of their One Touch site, so they've got a product called One Touch. On their site, they've dedicated a section to 2 Diabetes. 2 Diabetes is a patient social network. So they've given 2 Diabetes the opportunity to come in, patients are visiting, and these patients can talk and ask questions and interact on the J&J LifeScan site. Another J&J innovation, Children with Diabetes is a website that was started in 1995. And if you go on this website, it's actually quite wonderful. There's patients, they're asking questions to each other, they're helping each other out. It's really helping people deal with their disease. J&J bought the website 2 years ago. They bought that social network. So one might say, you know, cry foul. How can J&J now own that website? Well, they're not allowed to advertise. That's not allowed, and it would probably shut the site down anyway because patients wouldn't like it. But they actually own the website. So what do? They send their product managers in to answer questions that are being asked by patients about their One Touch product. So these things are being done today as we speak, mostly in the U.S. The last one really isn't a patient one, but I thought it was fascinating, so I thought I'd share it with you. Sermo is another social network, but it's a social network for physicians. You have to be a physician. You get in, you talk about diagnostic problems with patients, problems you're having dealing with your practice, whatever it is physicians want to talk about. Pfizer basically partnered with them, and Sermo allows them to send Pfizer-affiliated physicians into the chat rooms to answer questions about Pfizer products. So far, Sermo is okay with it. The physicians in the social network felt that this was a good use of that social network. So there are companies out there that are pushing the edge, they're dipping their toe in, they're trying a few things that are out there. Why are they doing it? Go back to the diagram of the water, because patients are activating and they're taking control of their own health care. So the question I have is electronic social networking an appropriate place for pharma to participate? Yes, no, or maybe? See, this is the risk-taking audience. Very good. Next slide, please. So how can pharma participate today? What could we do in Canada today that wouldn't break the rules? And there are some things that we can do. Number one, you should be tracking your brand. What does that mean? If you have a diabetes product, you should be on Children with Diabetes website and see what those patients are talking about. It's free. You can find out exactly what your patients think about your product, the problems they're having with it, what they like about it. They talk about it all the time. There's companies that actually offer services to track your brand on these social websites. If you don't know what your patients are actually saying about your product, you're missing the boat, and the information's available. So you can do this today. Number 2, identify patient opinion leaders. There's a new opinion leader in town. Who are they? Well, all of these patient websites and all these patient social networks have somebody who writes the blogs. Everybody gets to write them, but there's usually 4 or 5 people who write the most of the blogs, and they actually become huge influencers in those social networks. They can actually influence the way other patients think about products, drugs, diagnosis, how my disease is being treated, all of those things. Find out who those people are, because they have a great influence over your constituents. Number 3, support a social network. The examples I gave you were J&J. There's other opportunities to support those things. They need financing as anybody else does. You have to be careful how you do it, because you don't want to taint that social network, because if the patients think that it's advertising, you're in trouble. And number 4, activate your consumer base. So create a program around a meaningful topic, not necessarily about your product, about the disease perhaps, that consumers want to engage in, and they'll come to that site to engage and chat and discuss those things. Do not, however, ever use this as marketing, advertising in disguise. Anybody who does any social networking, and it's mostly on the consumer goods side, will tell you that as soon as a consumer network sniffs out that this is about somebody trying to sell me something, you've just lost the entire influence that actually exists. So that's the one thing you have to avoid. So my final point is this. I think pharma is at a crossroads. A couple of speakers have already said this, but there is nothing in the world that is more personal than your health. If you've got it, that's great. If you've lost it even for a moment in time, you realize how important it is. Customers out there, patients out there are actually recognizing this, and they're activating. They're going out and they're finding out. They're doing it themselves because nobody else is giving it to them. We can either participate or we can just stand back and watch it happen. Can we do it within the regulations? It's going to be tough, but I think it's something that pharma needs to understand better and work on for the future. Thank you.